We continue with our conversations this morning, and we are going to be having one around disability inclusion. Both of our guests are in the studio this hour, and we want to welcome Tina Mungatana, who is a Principal Social Development Officer, and Samuel Kabue is expert with PWDs rights, that's people with disabilities. We want to say welcome to both of you this morning.
Thank you.
Karibu, and welcome to the hot seat of the Situation Room, where we look at some of these issues, and it's important to keep talking about them today. So we're going to welcome you to the Situation Room with today's proverb. CT is going to tell you what that proverb is and where it's from, and then you can tell us what that proverb means to you and how you would interpret that. Is that all right?
Yeah.
Okay.
Our proverbs for the whole of this week, which will end on Friday, come from the Republic of Mali. Mali is an important country on this continent, and the reason is because it has an extremely rich history. A history that, among other things, tells you that this continent was always at the forefront of the acquisition of knowledge, the acquisition of culture, the propagation of the same. For the longest time, this continent had kingdoms, wealthy kingdoms that played an important part in the development of what we now refer to as Europe. But that's a story for another day. The proverb: God gives nothing to those who keep their arms crossed. Let me repeat, it's not God gives a little bit, no. God gives nothing to those who keep their arms crossed. Yes.
Let's start with you, Samuel.
I think this is an encouragement of generosity and not holding from especially those who are in need. I think that's what it means.
You have put it well. Thank you. Simple and to the point. Yes.
What about you, Tina?
I think it is a call to go out there and do something. Don't just sit and wait for something to fall on your lap.
Right.
Just go out there and do something, and God will bless you.
Indeed.
Yes.
You got to make a move, isn't it?
Yeah.
You have to put one foot out, and you have to do something. You can't sit and wait for it to fall into your lap. That's great, and I think that's a great launch. I keep saying that's the most great launch pad for us to get into the conversation for this morning. And we're looking at what it's going to take to achieve disability inclusion across various sectors. Now, if we look at the disability conversation and people with disabilities in Kenya and what has been done for them, a lot of it has come from the fact that there has been little to none in terms of inclusion, but there have also been some good strides that have been made more recently. We've seen a lot of agitation, we've seen a lot of compliance in some areas. Many would say more on the private side than the public side in terms of compliance, but we want to take an overview of where we are today and then talk about what is necessary, because we know that it is possible, but we need to talk about what is necessary for us to do as an all-inclusive society. So let's start off with you, Samuel, and let's paint a picture of where it has been over the last, give or take 10 years, and what we have achieved so far towards inclusion.
I would want to, first of all, go a little beyond the 10 years and say, in this country, work on persons with disabilities started from the point of charity and giving those who cannot give, providing for people who are unable to provide for themselves. And that's how even the education that we received from the missionaries, told us, a professional kind of care. But in the last few years, especially, I would say almost 20 years of the Convention on the Rights of Persons with Disabilities, there has been a real reawakening of transformation from charity to rights. And this has permeated not only at international level, but also at national level. And that's where we talk, for instance, in Kenya, of the 2003 Persons with Disabilities Act that provides for specific rights to persons with disabilities. In the last few years, 10 years, you've said in Kenya, we have struggled as a country to move towards the achievement of the provisions of the rights of persons with disability as embedded in the Convention on the Rights of Persons with Disabilities. And cardinal point in this is participation and inclusion, full involvement of persons with disabilities, and what we now call meaningful participation, not just being there, but being there in the principle of give and take, like everybody else. The convention, our constitution, 2010 constitution provides for progressive realizations of 5% representation of persons with disabilities in all appointive and elective positions. And that is a progressive point of view that has taken place within the last few years that we need now to follow up. We also have been working very closely with the government, the disability stakeholders, to review our 2003 Act so that we can bring in the issues that came up with the convention and those things that are now embedded in our constitution. And this is where we are today. And inclusion has been a discussion, particularly, as you said, from the last 10 years. We have not reached there. Much needs to be done, but we are not where we were 10 years ago.
What would inclusion mean, really? Because when you talk about inclusion, what is then suggested is that there has been exclusion.
Exactly. There has been exclusion. And I began by saying people with disabilities were seen to be those who receive what other people give.
Charity.
They were not seen to be people who also can give. And inclusion now has to do with ensuring that we see each other on equal terms. Disability is only a very small part of me. But there's much more in common between me and you. And so you should not say, because I cannot see, I cannot have a job. And today we have many jobs that do not require muscle power. There are many. The technology has also brought us ahead and said, yes, they are all jobs that people with disabilities can do like any other person. So I should not be expected to sit there and be fed. I should also be given the opportunity to also be a productive source. I should also be part of the producers, not just people who consume.
Right.
That is what inclusion means.
Let me take even deeper and further into the matters of political or national importance. Just the other day, when we were doing the census, there were concerns about the exclusion of persons with disability. I don't know how this has improved and how you feel about it. We're looking at voting, we're looking at being counted and being pretty much, vocal and included in matters of national progress. How do you feel about that in as far as inclusion is concerned?
Thank you very much. In 2022, at the beginning of 2022, we petitioned the IBC on the issue of inclusion. And they came up with a small committee called Disability Inclusion Coordinating Committee. I happen to chair that committee. And this committee was looking into all issues relating to elections. For instance, are people with disabilities able to access the voting station and vote independently? Are they included in the cohort of workers that were employed by the IBC in order to run the elections? Are they part of the people who are being voted in? And these are some of the things that we tried to work on. Of course, we cannot say we succeeded fully because, for instance, in our in our constitution and in the County Government Act, it provides for the representation of persons with disabilities,
Right.
Particularly in the county assemblies. But we found that during the first elections after the constitution, 43 counties had the representation of persons with disabilities. During the second one, 2017, we found that this went down to having 17 counties without representation. And in the last election, 22, we had 21 counties that didn't have representation. And this is not a reflection of what the Constitution provides, progressive realization of 5%. We've been regressing rather than progressing. So these are some of the concerns we can see in the political arena. We have the Senate.
Right.
And the Constitution very clearly says there must be 2 people in the Senate. That has been adhered to. We have 2 representations of persons with disabilities in the Senate. The National Assembly wasn't clear. It said people with disabilities shall be represented, but it didn't say by how many people. During the first elections after the Constitution, we had 5 people with disabilities in the National Assembly, specifically elected to represent issues of disability. Today, there is only 1. So we are not moving very well in terms of political inclusion.
Right.
Yeah.
Okay, so let's come to you, Rita. And Tina. I beg your pardon. I just switched the letters around, didn't I? Sorry, Tina. When we now look at the work that you do from a social perspective, explain to us some of the implementation, factors that have to be put in place when we talk about inclusion. I mean, across board for the different kinds of disabilities in the country. Is it possible for us to say, yes, inclusion can take place and can take place at least to a satisfactory level if we just prioritize certain things?
Thank you very much. And as Dr. has said, we have moved from charity-based to rights-based. And we are looking at inclusion as a right for persons with disabilities. They have a right to be included. They have a right to sit on the table. So as from where I sit in the Ministry of Labour and Social Protection, we are looking at what laws and policies are in place. As a country, we have signed up on matters legislation for persons with disabilities at the international level, where we have the Convention on the Rights of Persons with Disabilities, where we are signatories, and we have at the regional level we are looking at the protocol on the rights of persons with disabilities, and within the country we are looking at the Constitution. And then we are looking at the Persons with Disabilities Act of 2003 that we are currently reviewing. We are also looking at policies and legislative frameworks that we are developing as a ministry so that persons with disabilities are included more and further. But also in terms of programs, as a ministry, there are many programs that you're running that are disability inclusive. And some of the programs include vocational rehabilitation training, where we offer training for persons with disability so that they can enter the job market. And then we have sensitization programs across board to the public, to our stakeholders, to the counties across the country, because we have officers across the country, in the counties and sub-counties. So the sensitization forums, most of the time disability inclusion is not achieved because people do not know or people are not aware. So the sensitization programs are bringing awareness at a level that is at the lowest level, so that persons, the community is aware of the rights of persons with disability, is aware of the abilities of persons with disability, is aware that they can sit on the table and bring development, talk development, because they have the ability to do that. As you can see, Daktari is here.
Yeah.
Yes. And he has gone through the Kenyan system, and right now he sits on the table that makes decisions. So for us, inclusion is bringing persons with disabilities to the table that makes decision, not just at the end of the process, but all the way from the beginning. We are looking at all sectors, not just one sector. We're looking at education, we're looking at health, we are looking at agriculture. What can persons with disabilities bring? What can persons with disabilities contribute to the table? And something that we are not doing well on is data. When you're talking about development, we are talking about the numbers. What numbers do we have? Do we know the numbers of persons with disabilities? And that is something that, as the government, we're working on with KNBS. We are looking at doing a national survey for persons with disabilities so that we can have the numbers. When you
do we not know the numbers now? I'm sorry to interrupt you, Tina, but do we have an idea, ballpark, of the numbers of people in Kenya with disabilities?
According to the 2019 census? Yes. That's what we are relying on right now.
Okay.
Yes.
But they are really disputed.
Yes, that's what I was going to say.
Yes.
The point is, currently, the World Health Organization and the World Bank have international figures of people with disabilities. They say 16% of persons with disabilities are persons with disabilities in the world. And, we live in the third world, and probably ours would even be higher. But the point is, the last census indicated that the persons with disabilities in this country are 2.2%. That is 918,000 only. But if we go with the 16%, there should be more than 7 million persons with disabilities in this country.
8.8 actually.
And I talked of disability inclusion in the elections, and the data that was given by the IBC after the audit done by Pricewaterhouse on the registration of persons with voters, it indicated that persons with disabilities comprised 8.7% of the voters. That meant 1.7 million person voters only. The Kenya Institute of Special Education had carried a survey in 2019, and they found that there were 1,900,000 children with disabilities in the school system, and they estimated that 500,000 were not in school system. That comes to about 2.5 million children of school age who should have been counted by the census. So there is a problem in the area of the census, as Tina here has said. And this is what is now being addressed, because we in the Disability Stakeholders Forum challenged the 2.2%.
Right.
And we engaged with the Bureau of Statistics. And so they are now trying to put in together money to do a house domestic survey to really provide the proper statistics on persons with disabilities in this country.
If we're still doing surveys at this point to then get and see what numbers that we have, I find myself getting pretty nervous because if we do have more numbers every year, what does then that mean when we're already talking about trying to get towards inclusion, and that there's so many things that must be done? I mean, and we can say it. I mean, Samuel, you're here today. You're here. You have a vision disability. We know that if we're going to talk about inclusion for people with vision disabilities in Kenya, what are some things that we're talking about? Do we have Braille available? Braille available for students in class, for example? Are we not setting up mechanisms within government and private sector for people who have vision loss or vision impairment to then be able to work? Like Simon is saying, Samuel is saying that's part of his. That's not all of who he is. It's just part of him. So if we're still today talking about let's find the numbers. At what point are we going to get to the place whereby we say, let there be some kind of provision to make sure that children with disabilities at the school level have access to vision kits with Braille? At what point are we going to get to when we say that there must be bills and act in Parliament that's going to ensure that people with vision impairment are able to work a normal job? And that there will be an insistence on the people who set up these organizations to say that, yes, you must have somebody on your payroll who is a person with disability. But beyond that, you have to have the disability furniture infrastructure to ensure that this person can work here. When will we get there?
And even just to add, looking at the, how do you call it? The demography, that people with disability are not heterogeneous. We're looking at the gender aspect as well.
Yeah.
And as far as the infrastructure and what needs to be put in place is concerned.
Yeah. And as Dr. has said, we have come from far. We are not where we are 20 years ago, 10 years ago. It is work in progress. We do not have the correct data right now, but we are working on getting the correct data so that we can bring out programs and policies that are specific to specific types of disabilities or to gender-sensitive types of infrastructural changes that can accommodate persons with disabilities. So as the ministry, we are working closely with KNBS so that we can have that data, because the data is the one that will assist us. Right now, we are working on the 2019 census, and that is our baseline for now. So the programs that we have might not be 100% inclusive, but we are working towards getting the right data so that we can bring out programs that are specific to certain types of disabilities. And even as we go there, we are looking at programs run by the National Council for Persons with Disabilities, that is a saga under the ministry, that looks at what can we do, the implementation part of policies and programs for persons with disabilities. What is being done at the county level? What is being done at the national level? What changes can we bring so that persons with disabilities are more involved? Is the right information getting to persons with disabilities? Is the communication getting to persons with disabilities? Are they getting services when they go out to seek for services? Are there, like, for example, sign language interpreters? Are there Braille services, as you've said? So those are things that we are looking at and we are working on achieving. We are still work in progress, and as we move on from as the years go by, we are getting better. So actually, once the data we get the right data, and we know the changes are there every year, then the programs will be more specific to the types of disabilities.
Okay. Now, Samuel, let's look at some things that have actually been done, whereby they were not there before, that we can point to and say, sure, we've made progress, and if anything, it encourages us to do more.
I think one of the most important things that has been done is putting in place a legal framework. Before 2003, we did not have any legal framework on which to base the issues of disability. But we came up with the 2003 Act. Then I said we ratified the Convention on the Rights of Persons with Disabilities as a country in 2008. And we've been able to follow that very closely. The Kenya National Commission on Human Rights has been designated as the monitoring agent for how that is being, implemented, and that's a big step. Then we have talked of the Convention on the Kenya Constitution. Kenya Constitution has several clauses on issues of disability which were never in the previous Constitution. For instance, in Article 54, the issues of disability are specifically highlighted. The whole question of how we need to treat persons with disability, the issue of inclusion in education, and then clause 2 is what I said, provides for progressive realization of 5% representation of persons with disabilities in all appointive and elective positions. This framework, and now, as Tina mentioned, we are reviewing the Persons with Disabilities Act to include issues that have come up more recently that were not there when we worked on that act. So the presence of a framework has been very, very crucial. The establishment of the National Council for Persons with Disabilities in 2014 is another progressive issue, where this council needs to be given more powers to be able to supervise and to see to it that the policies and the legal framework is properly implemented. That is not as well, very well achieved, and it needs to be achieved. The other thing, coming to statistics, and of course, Tina confessed that we have not done very well with the statistics, but we realize that there are many other sources of statistics other than the Bureau of Statistics, rather than the 2.2%. I mentioned, for instance, in the Ministry of Education through KISE survey, the National Council for Persons with Disabilities has been collecting information. I mentioned the IBC disaggregating their data and giving numbers of persons with disabilities. These are issues that were not there before, and they are happening. And so when we say we don't just rely with the Bureau of Statistics data, there are other sources of data, and there can be more, because we haven't explored the data that is within the Ministry of Health, the people with disabilities who seek health services, and health is one of the areas in which we are also seeking proper inclusion. So there are things that have been done, but as Tina said, we are on the journey. It's work in progress. And may I also say this? The department that Tina represents, the Department of Social Development, has done very well, particularly in inclusion. They have an outfit they have established called Interagency Coordinating Committee that brings together representations from government departments and from organizations for persons with disabilities and other stakeholders in disability work. And this Interagency Coordinating Committee is trying to look into how the government is implementing its, commitments in different ways. And so that department can be held for really being inclusive and really trying to do the best. But other departments in the governments are not doing the same.
Okay. And it's needed for that everybody needs to come together, essentially, is what we are saying. And it's needed for other departments to be aligned. Otherwise, it won't work. Is that what we're saying?
Exactly.
Okay.
Yeah.
Okay.
But see, what I find puzzling, though, is every time we have this discussion relating to people with disabilities, there is the assumption that we all understand what we're talking about. Who qualifies to be a disabled person?
Thank you very much. The National Council for Persons with Disabilities worked on this because they register persons with disabilities. And they worked with the Ministry of Health in identifying people with disabilities. And we have definitions of persons with disabilities. Our constitution has a definition of persons with disabilities. The Act, Persons with Disabilities Act, defines who persons with disabilities. The Convention on the Rights of Persons define who is a person with disabilities, and I'm not sure that that is any longer a very big problem. But what has been happening, we still are adopting a more of a medical model of disability where the Ministry of Health has always to confirm that you are a person with a disability. You have to go through an assessment for you to be registered as a person with a disability. Probably it's because people cheat, and especially in the past, nobody wanted to be identified as a person with a disability. Even those who had disabilities and had been able to cross over and be integrated properly, they didn't want to associate with the disability. But today, because of the benefits that are provided to people with disability, for instance, if you have a job, there is a tax exemption on persons with a disability. So everybody who has a job or who has an income want to be identify himself with the person with disabilities, and others who don't have want also to enjoy that facility. So it became necessary that the Ministry of Health has to be involved in certifying you as a person with disability. But we have we have definitions, we have classifications by the World Health Organizations as to who is a person with a disability, and so that is not a big issue, or except that point I've said, we have medicalized it a little too much. We needed social workers and psychologists to be involved, not just the medical people.
You see why I asked the question is this: if we talk about the classification and the definition that are provided by the medical fraternity, they then venture into what we call non-communicable diseases. They talk about people who have diabetes as being people living with disabilities. They talk about people who have other conditions which are chronic as people living with disabilities. And the element of classification that you mentioned then comes into fore, because even as you talk of disability, for you to be disabled, it means there's something that other people who are human beings like yourself have which you don't have, and you have a limitation that is due to whether it is a mental, whether it is a physical, whether it is an emotional impairment, but you have it. Now, why am I going into the lens that I'm going to with this? It is because until it is understood what a disability clearly is, even as we talk about dealing with it, it is very easy for us to leave something out simply because of that definition. Our constitution is not explicit in its definition of disability. We have to look at other statutes to be able to understand. And as you said, like the Act tells you a little more clearly. If our constitution, which we hold as the Bible, is not explicit, it points to the inability of people who are in positions of authority to understand the severity of the situation and why it is that you must leave no stone unturned in addressing this thing in the most comprehensive manner possible. That is my point.
Yeah, but the functional classification provides that disability has to be a condition that impacts on you and the environment to the extent that you have limitations in what you can achieve compared with other people. It is interaction, your interaction and environment, and the limitation that comes in there, so that there are areas in which you cannot function like other people. So what you are saying is correct, that medicalizing it may bring a problem, but even now the document we have in Kenya has outrolled some of those things you have talked about, the chronic diseases and so forth, unless that chronic disease affects your functional ability.
Thank you.
So now, sorry, Tina, I know you wanted to make a point on that. If I can just join that to a question, is that then in this case, where we're talking about the legal framework that has already been put in place, that unfortunately we don't see enough cohesion from the different departments that need to be working together to make sure that some of these things come through. And the implementation of said legal framework also then becomes a pain point, but do we foresee or envision a situation whereby legal framework now births implementation now births further development, and we get to a point where already persons with disabilities have been dealt a tough blow? That's true, but that we don't prolong or exacerbate that tough blow by making sure that these things that Samuel is talking about are actually put in place and done. Can we envision such a situation?
Yes, thank you very much. So for the legal framework and implementation, it has been a challenge. That's why we are reviewing the Act of 2003, because it is way beyond. It was developed way beyond the Constitution of Kenya. It was developed way beyond. We became member states of the Convention on the Rights of Persons with Disabilities. So the review brings with it the powers to implement. And we want those powers, the National Council for Persons with Disabilities, to be able to implement, to be able to have the powers to hold people accountable for not implementing or adhering to to what the Act says. So, as I said earlier, it is work in progress, but we are looking at, once we review this Act, then who has the powers to make sure that the other departments, other stakeholders, the private sector is implementing those things that we have put in the Act.
Who's going to be reviewing the Act?
We are the ministry,
yes,
stakeholders, the National Council for Persons with Disabilities,
and of course Parliament.
And of course, it has to go through Parliament and Senate and be passed. But it is an all-inclusive, because we are working with persons with disabilities. Persons with disabilities have to be involved from the word go.
Exactly.
So we have gone through the process. We go through public participation. We go through engagements that we listen to them and they listen to us, and then we bring it all together so that we are all in agreement.
I'm sure in the past there have been engagements with persons with disabilities.
Yes.
Now, with regards to the subject of inclusion, what have they said?
In the past has not been as inclusive as it is currently. So in the past, persons with disabilities were brought in at the end to rubber stamp, or to just say that at some point we involved persons with disabilities. So the process will have gone through, and then at the end, when they are just about to launch or finish the process, then they bring in persons with disabilities. But right now, persons with disabilities are more aware of their rights, so they want to be involved from the word go.
Okay.
Dr. Kabue here will tell you, we have, as a directorate, we have worked with persons with disabilities, organizations of persons with disabilities, so that they are involved from the word go for any process that you're going through as the ministry, from policy development to programs. I was going to ask, when you say involved, what do you mean?
Yeah, because I want to add on that as well. When you say involved, what do you mean? Especially from the word go. And I'm more inclined to, when you said people don't know, all right? You said persons with disability are now more aware. Now, I want to go back to the rest, and we're all human beings, the way CTs put it. But the aspect of making it a wow factor, that you should know that these people have rights. Yeah. Would it begin earlier in life? Would it begin at the community level way earlier than later, where you have to now bring it into the curriculum and start to sensitize people, like on this platform, that people just know they are part of us, they're part of the community. It's not a wow moment. When do you start?
Yeah, so as I mentioned earlier, as the State Department for Social Protection, we have officers all the way to the sub-county. So we have the headquarters, and then we have the regional level, and we have the county level and the sub-county level. At the sub-county level, where the rubber meets the road, our officers do sensitization forums for persons with disabilities. Throughout our implementation of all our programs, persons with disabilities have to be involved. So we do barazas, we do sensitization meetings, we do boardroom meetings with persons with disabilities. We have committees that represent the community at the locational level. That brings that committee ensures that there are persons with disabilities sitting in that committee. So when we say we involve, when we come up with a program, like the State Department did a support needs assessment for persons with disabilities and their primary caregivers. We are looking at persons with disabilities, but what are their caregivers? What about their caregivers? Are we looking at what they have to go through? Are we looking at support or programs that you can bring to the... So we went out to the community. We went out to the grassroots level and brought together persons with disabilities and stakeholders and sat together and engage them to see what programs can we do for caregivers of persons with disabilities. There are persons with disabilities that require 24 hours care. That caregiver is abandoning all they have to do to take care of this person with disabilities. They have to be there 24 hours. So the person, the caregivers have their own needs, their own economic needs that they are leaving behind. But what can we do to ensure that their caregivers are well taken care of? Even their psychosocial needs. When you take care of a person with disability for 24 hours that needs you there all the time, then you need a break sometimes. What can we do for persons for their caregivers to have that break? Can they have a program that gives them some time off to just be themselves? So those are programs that we implement as a state department. And also the sensitization part is really important. If persons with disabilities know their rights, what about the community? Do they know the rights of persons with disabilities? Do they know how to communicate to these people? Does communication reach to all people, including persons with disabilities with visual impairment, with hearing impairment? Are they included in passing the information or passing whatever information that is needed? Right. Yes.
Samuel, are you comfortable that we're on the road to inclusion and that this road is long and leading, or it's going to stop at some point? Are you comfortable that we're well on the way?
It's a rough road. And I say this because we have talked of a very elaborate legal framework. And we have clearly said that the implementation is in itself a hitch. And may I also point out that we live in an age, especially in the since the Convention on the Rights of Persons with Disabilities, we're in an age where it's politically correct to talk about persons with disabilities. You'll hear it with the politicians, with everybody. But much of it ends there at the talk. I'll give an example. The Kenya Kwanza Manifesto provides that within 18 months, NHIF was going to cover persons with disabilities in matters of health. Within 18 months, we are now in 2.5 years.
Yeah.
Nothing has been done about that. So we have there are statements that will make that never find the light. So the point is the good thing about the legal provision is that as we come into an awareness of the situation, even persons with disabilities have a role. We've said that we don't have an agent today that has powers to enforce inclusion. For instance, we have the constituency development funds. They provide for bursaries, but if they were also to provide 5% of their funds was to go to bursaries to persons with disabilities, it would be a good idea. And since they are part of this country's law, that is what they should be doing, but there's nobody to enforce that. So we need that kind of an enforcement. And more so, we are getting to a point where sometimes we revert to a legal situation. For instance, the National Gender and Equality Commission went to court about this lack of representation of persons with disabilities in the national assemblies.
Yeah.
Of course, we also have laws that contradict each other. For instance, the election law, the political parties law provides that the list that is given by the parties for nomination cannot be altered by IEBC. And so you are told to, for these nominations, you give 8 8 suggestions of who would be nominated if you had the chance to nominate. Most parties will have only 1 or 2 chances to nominate a person. And if 5 of them begin with the youth, the woman, the worker, so the persons with disabilities is put number 7 or 8.
And that can't be the
you
case.
find they are not there. So this law that prohibit IBC to equalize the positions is a hindrance.
And needs to be looked into.
It needs to be looked into.
Well, I mean, I want to thank both of you for being here this morning. These are conversations that we must continue to have because the road to inclusion is still a long one and that there's work that's being done along the way. Tina Mungatana is the Principal Social Development Officer and Samuel Kabue is an expert on persons with disabilities rights. And they've been here with us this morning.
This is the Situation Room, the only way to start your day.